So, welcome, Doc. Dr. Vincent, is it okay if I call you Dr. Vincent? I
Yeah,
like
that's
saying that
fine.
name.
Vince is fine.
I
Thank
love
you.
the fact you have 2 Italian names, a first and a last Italian name.
Well, yeah, I'm named after Vincent van Gogh, so I'm probably a little bit more Dutch.
Okay, gotcha. Very nice. Well, it hits home with me anyway. But nevertheless, so the first thing I always like to ask is just tell me a little about yourself, how you got to where you are, just a little history.
Well, I have to say I started off at the University of Minnesota as a biochemist, biochem undergrad, and graduated during the Carter administration. And double-digit inflation, economy was going down, and I was a restaurant manager and I waited on tables and managed 3 restaurants. And eventually got up to that. And I have to tell you, the reason I bring that up is because being a doctor, I think waiting on tables was probably one of the best experience I ever had. Tried to juggle, 6 things at once and moving quickly without looking like you're hurried, and to give each person a sort of a response and make them feel like they're an individual while you're in your mind, you're rushing. I gotta get to that next table and make sure they get hot food. I have to say that experience was pretty good. I mean, if anybody's out there that's been a waiter or a waitress, they could say that really helped you in training to be a doctor. Being able to deal with different peoples and different people's needs. After I did that for a while, I decided I need to go back to school. I didn't want to do that for a living, and had a great experience with chiropractic. And believe it or not, the university wanted at Northwestern University wanted a biochemist to teach. They lost their professor. So the president had asked me to teach a class, and I went there for an interview and became a student instead of a professor. So that's how I started at Northwestern. I was so impressed with what was going on at the chiropractic college, and I said, "Man, I want to do this for a living."
Prior to that, were you a chiropractic patient or anything?
My grandfather told me I was when he took me to his chiropractor. I just didn't remember it being any different than any other doctor.
Gotcha.
So I didn't know it was a chiropractor. I just, it was a doctor. That's all. I didn't remember it being a chiropractor. Yeah.
Going back to your restaurant days, circling back to that, I used to hire staff based on whether or not they were a waitress at one time or another. And I looked for waitresses and I looked for bartenders because I always felt that they had a good grasp on customer service and multitasking and all the stuff that you said. So I thought
Yeah.
that was pretty interesting that you came from that.
Yeah, I tell people all the time, don't downplay it. Any type of customer service that you've learned to deal with problems too, and how to make it better. So I figure every problem's an opportunity to wow somebody. To if you do it right.
Absolutely. Absolutely.